Hello, and welcome to another post from Dr. Blake's Healing Soul. I'm on location here in Hawaii, and I'm near Hana on the island of Maui. I'm in a bamboo forest. This is actually the newest or youngest part of the forest. You can listen through the video for some of the sounds it makes as the wind rustles through it. It's quite incredible. Today I want to talk about injuries and the treatment of injuries. When you are injured initially, you are in what is called the immobilization anti-inflammatory phase. The fastest you get to a pain-free level, where you're between pain levels of 0 and 2, the faster you're going to heal. Many make the mistake of attempting to tempt fate and push through when they first get an injury and end up prolonging their injury greatly. So you need to honor the pain, listen to your body, all of the nice golden rules, and begin to create this pain-free environment. In creating a pain-free environment, it could require you to go into a removable boot and or on crutches. You need, if there's swelling, you need to work on the swelling as best you can. Icing for 96 hours or 4 days is crucial. I have people ice for 10 to 20 minutes 4 or 5 times a day when they first get injured. And then if the swelling remains after that period of time, then I think it's really important to begin to do contrast baths to help flush the fluid out. You can take anti-inflammatories on advice from your doctor, or taking 2 Advil or 1 Aleve on occasion when the pain is bad, or to allow you to sleep, is normally acceptable. But we don't want to mask pain either. When you are injured, you need to substitute your activity for another with another activity that doesn't produce pain. So a lot of runners need to get on the bike. A lot of swimmers need to run. It really depends on what your injury is, but you do need to cross-train, and I think that's an extremely important factor. Whatever the injury that you have, you always ice after you work out, as you begin your re-strengthening and return to activity phase. So you keep icing sometimes for months and months to get back to until you're back to your full workouts. Icing is your friend in this case, and really helps control inflammatory pain and doesn't make the injury pain, doesn't mask that injury pain as long as you don't ice right before you work out. There's a lot in sports medicine. There's a lot of braces that we use, tapings that we use. My blog, Dr. Blake's Healing Soul, is full of those braces for ankles and knees, and taping for toes, and splints for toes. So you should be able to find the right brace that gives you some comfort, period. So try to also, if you've injured your knee, try to strengthen your quads and your hamstrings. If you've injured your ankle, try to strengthen 4 directions around your ankle. And again, in the blog we have examples of all these exercise programs, and a lot of people need help with a personal trainer or a physical therapist in that regard to develop a good program. But you should be, initially, when you first get an injury, assume it's going to take 3 or 4 months. especially if you're limping, and get right on strengthening it from day one. So I think those are the crucial things: to use anti-inflammatories like icing and occasional medicine for an extended period of time. You need to get right on a cross-training program, get on a re-strengthening program of the injured area and the whole lower extremity if it's your foot or ankle, and really try to keep things keep things moving so you decondition at the least. Learn how to strengthen it, but also learn how to brace it if that is if that gives you some good relief. And there are myriad of different ankle braces and different foot sleeves and toe sleeves that help immobilize even toes. So I hope this general approach to developing a good rehab program when you're injured will help you in good steads. And aloha.